Recent HIPAA enforcement activities hit small group practices and businesses with significant impact. By Gregory Ewing, Star Compliance Services, LLC. I guess that it's safe to say that covered entities and business associates alike have experienced 3 phases of HIPAA enforcement. Phase 1. The early days. Originally, during the early days of HIPAA, there was little or no enforcement. In fact, a covered entity had to do something so outrageously egregious that the Department of Health and Human Services, HHS, Office of Civil Rights, OCR, the Civil Rights and Health Privacy Rights Law Enforcement Agency, was forced to act. Phase 2. The HITECH Act. The next phase began around the enactment of the Health Information Technology for Economic and Clinical Health, HITECH Act, enacted as part of the American Recovery and Reinvestment Act of 2009. At that time, the targets were usually large institutions like hospital systems, national pharmacy chains, and health plans. Providers worried about audit. During the 2 previous periods, small business health providers such as dentists had very little to worry about in terms of being subjected to an audit. Maybe the OCR followed the pattern of many federal prosecutors and thought that busting a couple of solo practitioners or single-digit or low double-digit medical groups just didn't have the same press as bringing down a national chain or large healthcare provider. In fact, before the HITECH Act, HIPAA did not require healthcare providers to notify anyone in the event of a breach. Phase 3, the latest phase. Now enters the 3rd phase, where anything goes, at least when it comes to the small business healthcare providers. In December 2013, Adult and Pediatric Dermatology, PC of Concord, Mass., AP-Derm, a 12-physician organization, agreed to pay $150,000 to HHS for potential HIPAA privacy, security, and breach notification rules violations. Specifically, AP-Derm reported a stolen unencrypted thumb drive containing 2,200 patient records. The records contained information about procedures and photos of patient cancers and procedures. However, the records did not include any financial data or social security numbers. Corrective Action Plan. In addition to the payment, HHS required AP-Derm to implement a corrective action plan to correct its HIPAA deficiencies, which includes developing a risk analysis and risk management plan to mitigate any security risks and vulnerabilities. This case marked the first time that HHS settled with a covered entity for not having HIPAA policies and procedures in place to address the HITECH Act. Specifically, the practice lacked a written and regularly updated risk analysis, a formal risk and security plan, an adequate breach response plan, and HIPAA training for its employees. $100,000 settlement HHS case. In April 2012, Phoenix Cardiac Surgery PC of Arizona, practice, agreed to pay $100,000 to settle its case with HHS and take corrective action to implement policies and procedures to safeguard the protected health information of its patients. Initially, the case began with a report that the physician practice had a publicly accessible internet-based calendar, which it used to post clinical and surgical appointments. However, after further investigation, OCR found that the practice had implemented few HIPAA policies and procedures and limited safeguards to protect patients' electronic protected health information, EPHI. In this case, OCR's investigation revealed the practice had failed to implement adequate policies and procedures to appropriately safeguard patient information, document that it trained any employees on its HIPAA policies and procedures, identify a security official and conduct a risk analysis, and obtain business associate agreements in instances where services include EPHI storage and access. Other agencies join in. Other agencies also feel the need to protect patient confidentiality, particularly in the light of the increasing identity threat crimes, which are the result of inadequate security controls. In 2013, the Federal Trade Commission, FTC, filed a complaint against LabMD, Inc., an Atlanta-based company that conducts laboratory tests on physicians' patient samples. FTC alleged that LabMD, in 2 separate incidents, collectively exposed the personal information of approximately 10,000 consumers. Specifically, the billing information for over 9,000 consumers was found on a peer-to-peer PTP file-sharing network, with the personal information of at least 500 consumers ending up with identity thieves. Questioning FTC's authority. LabMD, with annual revenues of about $4.4 million, countered that the FTC had no authority to address private companies' data security practices. The court rejected LabMD's claim and stated that FTC had the authority to enforce instances where companies failed to employ reasonable and appropriate measures to prevent unauthorized access to personal information under Section 5 of the FTC Act, 15 U.S.C. 45. Additionally, the court found that FTC's enforcement power did not overlap with OCR's enforcement power under HIPAA. The cost of legal was just too high. In January 2014, LabMD's CEO announced that the company would wind down its business, citing the toll that the legal battle against FTC took on the company. Healthcare attorney Kirk Nara, a partner at Wiley Ryan LLP, stated that the FTC is saying that everyone regulated by HIPAA has to worry about us too. New OCR survey for audit program. On February 24, 2014, HHS OCR announced that it will survey up to 1,200 covered entities and business associates to determine suitability for its HIPAA audit program. The last time OCR reviewed covered entities under its HIPAA audit program, it reviewed the conduct, the privacy, and security controls of a dental practice. HIPAA risk assessments is the new focus. At the conference where this was announced, OCR Deputy Director Susan McAndrews stated that determining whether organizations conduct timely and thorough HIPAA security risk assessments will likely be an area of focus. She further said that risk assessments were a common weak spot found in the pilot audit program, and risk assessment deficiencies were also found in previous breach investigations. I think we're about to see the fourth phase of HIPAA enforcement. What the OCR hopes to glean through its survey, or how these surveys will assist in its selecting the next round of audit, is anyone's guess. What we do know is small business healthcare providers are now fair game. Ensure your HIPAA compliance meets standards. Also, it appears that OCR may have realized what many compliance experts have always known, that a large proportion of small business healthcare providers lack the resources, expertise, or even the motivation to ensure adequate controls are in place to protect patient data. In any event, it's time for small business healthcare providers to ratchet up all their HIPAA compliance activities, which include conducting annual risk assessments, having ongoing awareness education besides the mandatory yearly training, and designate someone knowledgeable and interested in HIPAA as the practice's HIPAA privacy and security officer. The right designated person. HIPAA does not require the designated person to be an employee. This allows healthcare businesses to hire someone externally to provide qualified HIPAA training services. Sometimes these consultants can be obtained at very reasonable monthly rates. One thing we know for sure is that small business healthcare providers are now on OCR's radar and appear to be easy targets. They need to take action and ensure they are in compliance or risk serious consequences.